introduce Marissa Fayer. Marissa and I met a few months back. She is the founder and CEO of HERhealthEQ. We had a conversation a month or two ago, and it was fascinating. And I'm looking forward to hearing her presentation this afternoon, which is going to be focusing on investing in meaningful companies and transforming healthcare in developing countries. So Marissa, let me hand it over to you, and welcome back to One Business World and Leading Entrepreneurs of the World.
Hey Glenn, thanks so much. I'm really excited to be here. It's been, I'll echo what you said, it's been like a really great 4 days. I've been popping in and out, and so so many great speakers. And so I'm just going to go ahead and share my screen. So Glenn, said it, and if you can hear sirens, it's because I'm in New York City right now, and it's just life on Zoom, I guess. So I'm going to be talking about investing in meaningful companies that are transforming healthcare, and just a quick intro, because all of this is online and in LinkedIn. But the reason I'm able to talk about this is because I am the founder and CEO of HERhealthEQ. I'm also the president of Fayer Consulting. I've spent a significant amount of time in developing countries. Our work at HERhealthEQ very much focuses on developing country healthcare and making sure that women have access to high quality equipment to have their health. At my consulting firm, we focus a lot on small to medium-sized businesses, really helping them grow, oftentimes in the developing world. I'm also the executive vice president of Deep Look Medical, which is an AI-like imaging tool. Specifically, I focus on women's health and breast imaging. And I'm also a venture partner at Assiduity Capital, and we're focused on healthcare in Africa. And so I've spent a lot of time kind of in the developing world and deploying products there and things like that. And so I've been exposed to a lot of, life and live and travel, et cetera. And so it's really exciting to be able to invest in companies that actually are making a difference, in the developing world. And so I've also wanted to kind of say that it is exciting to talk about companies that are in the US and focused on US or European healthcare, but there's literally an entire other half of the world out there. And so I think it's important for us to kind of think through that and understand why we should be investing in them. And so here's just a quick map of kind of who developing countries are and how they're labeled. And I'm happy to send this presentation to anybody who would like it as well. And so the blue ones are the developed countries, which you can see actually it's Europe, Australia, the US and Canada, and so and some countries in Asia. But the yellow and the red, especially the yellow, those are developing countries. I mean, it looks like that's literally 2/3 of the world. And so it's really important to understand that. And then it's also important to understand the differentiation between developing countries and an emerging economy. They absolutely are correlated because you could see kind of the color changes and color differences, but there's also kind of like a rating. An emerging economy is where there's a lot of significant growth and investment and opportunity. And so, the ones that this chart kind of puts into different colors, especially in red, they're sizzling hot, Chile, China, the Arabian Peninsula, those areas, the orange, South Africa areas, India, like these are all areas that we know of, but we have to remember that they're all still developing countries. And it's kind of exciting that there's so much opportunity out there. And I focus in healthcare. I think it's the most exciting area to be in, quite honestly. But healthcare is different in these emerging economies and developing countries. And I would love for us to kind of just, if everyone just to kind of level set. And there's differences from what we potentially in the US and Europe are used to versus what's around in developing countries. There is an immature infrastructure to support things that we think should be the norm. A CT scanner cannot physically be supported in certain developing countries because they don't have enough power to support them, or a foundation even, or rooms in hospitals that could be dedicated towards that. There's also so many different health conditions. And that's the other thing we need to think through, is that we're very much focused on what we call conditions of affluence in our developed countries. And there's other areas such as developing countries, which are focused on that as well. But first and foremost, they're focused on primary health care, infectious diseases, and just preserving health. And so there's different things to invest in. There's a huge focus for almost every developing country on universal health care. I'm in the States, I won't comment on that because, we all need to get there, I think. But there's a really big focus that needs to happen on infrastructure, building, capacity planning, solidifying regulatory structures. And, with all of these differences, I have to also say that sometimes it's not bad. And so, yes, things are different, but they're not worse. And is different better? Is different worse? There's nobody who can say yes or no. And because there's no regulatory structures, it also means it's it's much easier to potentially get new innovations approved in those countries. And I can take the example of e-health. E-health is so widely adopted in the developing world in so many places, where just because of the pandemic did we start hearing about it in the US and in Europe. And it's been going on in developing countries for years. I think like that's just one very obvious example. But regulatory wise, it's standard of care in developing countries. And also there's a lot more of a younger population. And so what that means is technology, such as digital health and e-health, is much more widely adopted. And I think that that's something that everyone really needs to pay attention to. There's also a very large growth in capital and access to capital to be spent on health. And because of that, there's a growing middle class, and middle class wants to spend money on their health. And so there's a lot of opportunity for market, quite honestly. But these are items that we can potentially think about in the future, and it's exciting that there's so much opportunity, but we still need to start focusing on what's the most important to start with in developing countries. And as there's such a range of developing countries, you can see that some of them are going to need infrastructure, and that means hospitals and clinics and basic needs, medicines that are real and not counterfeit. They need supplies. Again, we saw a lot of this come out very obviously in the COVID-19 crisis, but it was always there. And so the need for infrastructure is something that should be focused on first and foremost. You can't have a fancy medical device if you don't have the infrastructure to support that, or beds for people to stay in. The next area I would think of that's kind of one of the other secondary most important is capacity building. So creating medical devices that are appropriate for primary and secondary care, and ones that can be used for diagnosis of conditions and of general conditions, diabetes, heart disease. It doesn't have to be the fanciest of the fancy. It has to work, and it has to also be appropriate for the conditions. When I talk about developing countries, it's Latin America, it's Africa, it's Southeast Asia. There's so many countries in so many different ranges with so varying and different health conditions. That's top of mind and important. And so you need to balance what's appropriate for what is actually needed. And so kind of so back to the capacity planning, you need to focus on labs and emergency rooms and things like that. And then kind of the third area that I think is really kind of the top three of the focus of the most important is this technology for scale. But I personally almost wouldn't look at it until infrastructure and capacity building tools have been put in place. And when I talk about technologies for scale, I'm talking through like these very fancy and connected emergency rooms and operating rooms. This is where e-health really helps. Point of care, so that it's local, and it's whether it's in remote areas of cities or in villages or out in where other centers of population are, and also this connected health. And so there's certainly, of course, a lot of need. There's a lot of opportunity, and so just to kind of highlight what I think, and again, this is completely personal opinion, but this is kind of where I think it's important to invest now in developing countries, because it's meaningful. It makes a difference. It's not an iteration on just the first thing, or the it's not version 72 of a medical device that version 70, 68, and probably 50 were almost exactly the same. So we need to focus on, infrastructure. And this means not just building hospitals, this means equipping the hospitals as well. This also means clinics. This means getting care to where people are. So infrastructure also goes along with medical supplies, and making sure that those supplies and or the infrastructure, such as the clinics, are where people are, not just in a warehouse, not just in a city that yes is a population hub, but there's other hubs as well. And so, like I was saying before, there has to be equipment that's culturally appropriate and not always the fanciest. You need to have the equipment to that's proportional. That's the word I kind of always think about. It's very proportional and needs to be where it should be, which talks through distribution channels. So distribution across several countries is very difficult right now. And so if there could be centers of distribution and investment into that. And I know when we think about healthcare, we think about equipment and medicine and things like that. But if you can't get your equipment and medicine to where it needs to go, there's no point in working on that, because it needs to get everywhere. And one of the other big topics that really has been coming up is this quality verification. So to make sure that the products are real, the medicines are real, they're not counterfeit, they're not sugar pills, they're not laced with anything inappropriate. And really important to make sure that everybody has the appropriate medicine for their condition. And this kind of talks through what's regionally specific. And so in certain areas, infectious diseases are very common, and those need to be tackled. Once those are tackled, you can often start working on non-communicable diseases such as cancers and diabetes, and heart disease. Those are what is considered almost like the second tier of care, but those can be prevented, and they can be detected and treated and treated well when found early. And so, philanthropy has been very traditional when you think through, oh, I want to help developing countries in health. And it is quite cultural, it is appropriate, and it is absolutely still needed in certain places. But philanthropy alone cannot tackle all of the needs of a developing country and a developing region, or just the developing world itself in healthcare. And so we need to remember that investment still needs to happen. And I think investment actually has to happen more than philanthropy. And so when I talk through and mention, investing in health in developing countries, it's still an investment. So we have to remember you're still investing money and expecting a return. And so you still have to perform diligence. You have to check out the team, the technology, the regulatory risk, understand the market, know how to scale. It's still an investment, like as you would evaluate an investment in the US or in Europe, it's still an investment. But when you're investing in the developing world, there's additional areas that need to be emphasized and focused on as well. So they might not have a mature leadership team just because that is a lack of experience, because they have not had the opportunities to be in large companies that have scaled, very large, where many of us have been. So they're going to need extra support, and really this extra emphasis is a lot of developing country investments. They're looking for you to help them. It's not just capital. They're looking for smart capital. And so, we need to help them. And they're still companies, but we need to help them as investors to develop growth channels and work in distribution networks, like I was saying before, how to help and connect them to smart money to scale in other regions and scale in other countries, because geographically, a lot of them are very close and what we consider close, and there's a lot of crossover that can happen. But how to make that smart and how to think that through. And it really just comes with experience. So we've had a lot of experience in the developed world where we're making investments, we're helping companies, we're exiting them, we're reinvesting in them, et cetera. And so this happens often. And in the developed world, it just hasn't been happening as often because there hasn't been necessarily a need to get there yet. And so this is the smart capital and the help that these investments need. And so, you kind of think about like, oh, well, so she just mentioned it's really different. Sometimes they need a lot of help and it could be so difficult. So like, why would you invest in the developing world? The biggest answer that I can give you is that it's money. There's more people, there's more money. And it's a huge, huge, huge market opportunity. There is expected to be over 20% growth in the next 5 years. That's completely still with COVID-19. So this is not a number from 2017. This is a number that has come out recently. Again, there is 20% growth in developing countries, most especially given COVID-19, in healthcare. And so, the population is growing exponentially. 97% of the population growth is in developing countries. That's 1.2 billion people that will be added. Just I'll let you soak that in for just 1 second. But when you invest in developing countries, there is a huge market opportunity. And in addition to that, of course, as investors, we're really excited and interested about that. But you're also providing access to healthcare, and you're creating equity. And it's something that personally I spend a lot of time working on, is to make sure that there's health equity throughout the world. But investments can also create health equity. If you invest in healthcare, you're investing in developing countries growing and becoming more equitable. And so it's a very impact investment kind of thought. And, when I talk through investments, I'm not only saying that we're talking about impact investments, I am also mentioning that this is traditional for-profit investments. Want your 20 to 30% return, want your 4x. These are still absolutely happening, and honestly quite applicable and kind of probably easier to achieve because there's such an opportunity. Like I just said, there's such a growth in population and in spending. I was just reading a stat just before. I'm just going to quick look at my notes to get you the exact numbers, but it was something, it said 6.3% of growth is happening in middle income countries, 7.8% in low income countries. That is an increase in growth in healthcare as compared to a 3% growth in developed countries. So you are already 2 and 3xing the growth in spending. automatically in these developing countries. And I know the chart on the right is very small, and I apologize for that, but all it shows is that the blue line is 2017 and the red line is 2022, which is next year, scarily. You can see the red line way far exceeds every blue line in every region: North America, Western Europe, Latin America, Middle East and Africa. Like, every line is expanding. And so it's important to invest in these areas. The other thing that I kind of wanted to talk through also is that, investing in developing countries, you're typically investing smaller amounts. They're not going to be able to handle, there's very few investment opportunities that are above $100 million. They're even above $50 million. A lot of these investments might be sub 1 million, sub 5 million, sub 20 million. But these are growth potentials, which also leads to lower barriers to entry. And so it opens up opportunity for investment for so many other people. There's new opportunity for new tech, and that's really important. And there's access for people to continue spending, which I just always find exciting and interesting. And so, local investments are really important. These are the people, invest in them. They know what is needed, how to get it, how to implement it, know why this is important. And, you're investing in companies and countries and founders who are local oftentimes, or who have teams on the ground and are, they're being invested in, they're being thought of, they're doing their diligence on the ground. And so it's really important locally. But the other thing to remember is when you invest in developing countries and invest in healthcare that could affect developing countries, you're also making investments that matter. This means better health for everybody. And the World Bank just came out with a new statistic. It seems like every day, but this is a really great one I really loved. That in the next 15 years, they are estimating that there's going to be the creation of 600 million new jobs. So, but you can't work without your health. So if you're, as an investor, you're investing in healthcare, there's more people working, there's more disposable income, it just starts returning, and it's really exciting news. But the people who have these companies and organizations on the ground that you could be investing in, they give back to their families, they give back to their communities, they give back to countries, and it's really exciting, and it means something, and it's meaningful. And so, this transitioning of health into wealth, it's the goal. It's the goal in almost everybody in a developing country. And because you have the ability now to create wealth through health, which enables access to a better life. So I will stop there, and Glenn, if there's any questions, I feel like I'm looking at my watch and I for sure overshot my time as usual.
That's fine. Not
Yeah.
to worry. Not to worry. It's very
I'm passionate. I got lots to say.
I know. No, without a doubt. No, it's fascinating presentation, and it's really, it's really cutting edge. And when you think of all the good that it's doing in developing parts of the world, it's a tremendous mission. Hey, couple quick thoughts, just from just kind of listening and seeing some of the slides. When you talk about infrastructure and capacity as kind of the first two pieces, when you're working with developing countries, how much interaction are you having, like, with the local government or the local health authorities? Because, as you know, in this country, to build anything, you need a certificate of need and all of those types of things. How about is it because you also had down low barriers to entry? Is it a quick turn? What's been your experience?
Yeah, so I find it's most effective to work with teams that are local on the ground. because most of the time they know who to call, they know how to get it done. And if they don't, that's kind of where they're also looking for the help from investors who might who might know that. So a lot of the times you have to think geographically. Is there an investor who knows the landscape in Mexico, for example, and could make those calls to get some sort of regulation or growth potential or land deed or something to maybe grow a facility or something like that. So you have to, when companies are looking for investors, I think they need to be really smart about it too, and look for who and how it can help them, and not just take money to take money. Take money that's this phrase, smart money. I personally always like to work with a local team because they're the ones that have the expertise. And I've also found that, when you go to the ministries of commerce or trade or, any of these, they really do want what's best for the country. And they're very welcoming to investors, obviously, because you're growing jobs, infrastructure, healthcare, whatever it happens to be locally. And so if you're remaining kind of in the country or in the countries or the region, I think they're welcoming. And listen, like, there's always examples where that's not the case. There's always examples where it's corrupt. But I think as it's getting a lot more sophisticated in the past few years, and it will continue in the next few years, that a lot of that might start going away. I mean, that's always the hope. I really fall back on the phrase of smart money.
Yeah, no, makes sense. And when you think about changing the colors on the map, right, from developing to emerging, or as you progress along,
Mm-hmm.
obviously technology is going to play a part in that. Smart capital, as you said. When you look at some of the e-health uh, technology, or looking forward through that is such a strong possibility, even in this country. We certainly saw that during the pandemic era, how something previously not all that well thought of, even under reimbursed in certain insurance markets, now is like almost a given. When you're looking at developing countries from an e-health standpoint, are there any challenges around, say, broadband and the internet and things like that?
Yeah, so there is, but it's always ironic that I have better cell coverage in Africa than I do in New York City. I mean, it's sad. I don't know if it's the satellites flying over, or I don't know if it's kind of where I am, but like, I could be in the middle of nowhere and I have far better coverage. But it is a problem. It's also what they're working through and thinking through. So, that's also part of the infrastructure side of things. But they're also creating technologies that are going on SMS, or that can be archived and sent to the cloud when you are in a region or in an area that has Wi-Fi. A lot of times the local clinics are Wi-Fi spots. And so actually a lot of people will come, which is a great, a great motivator for people to come to the clinics, because they are Wi-Fi hotspots. And that's some of the investment that's been happening to equip these clinics, because then you have access to all this data. And so oftentimes when we're thinking in developing country, it's not going to be instantaneous. Some of the discussions are also, again, happening on SMS, which does not require broadband. They're happening on like WhatsApp. They're happening on different messaging channels and different ways of communication. And so that's how they're oftentimes getting around the instant need for care. They're also not, they're not overly graphic. So it's not taking up a lot of broadband. It's direct to the point. It's a messenger. It's this. It's that.
It's basic messaging. Okay.
Oftentimes it's very basic, or there's multiple levels of it, or you can do it on a basic cell phone.
Well, you talk about good health, right? And by having the good health, you are creating equity, because
Mm-hmm.
you're enabling people to then still go to work, provide for their family. And I think you had on one of your slides, you had a bullet, family stability.
Yes.
And that's obviously that's an important aspect. even in this country, as people struggle with long-term illness or chronic conditions and the like, it becomes an important mark. When you look at some of the work you do in the developing countries, how shiny does the new technology have to be, or can you get by with uh, last year's model? Because I know we've previously talked about sometimes repurposing some of the machinery that perhaps in a giant medical center is like, well, that's last year, we need this year. How much of that happens in developing countries where they'll come back and say, they put their hand up and say, we'll take it?
Yeah, I mean, that's obviously the work of what we do at HERhealthEQ is taking this to, these 2-year-old models or whatever and getting them to the places that need them most. Quite honestly, there's centers in the United States that would be quite willing to take a lot of this equipment as well. And so we've seen that throughout the pandemic where, you innovate and you think through like, I can create a ventilator in my garage and it doesn't have to be the fanciest. But developing countries, I don't ever want it to be like, oh, I'll just take everything, because I actually don't think that's the correct model. But if something has a useful life of 25 years and they can get it after year 3, exactly like a car, why would you not take year 3? And they don't care. There are, of course, going to be always centers that are, no, I want the state of the art, and that's fine. That's not necessarily probably who HERhealthEQ, we target. They have the capacity. Oftentimes they're private or government run, or they are the spokes hospital for the country. But I have not come across a single person, quite honestly, who wouldn't take last year's model of an ultrasound machine or a mammography, because it does not exist and there is no access to this equipment anywhere in the countries. And so to have it, even if it's 2, 3, 5 years old, 10 years old even, it's providing care. Mm-hmm. These doctors and nurses and health clinicians and community health workers, they want their communities to be healthier. They don't care that there's a scratch on it. There's going to be a scratch on it in a day anyway. So nobody cares that there's a scratch on it. Nobody cares that the logo is a different color than what's currently out there. It's something of affluence where we want the fanciest and the best is oftentimes not the newest. So I haven't had one person say, we're good, we don't need that.
Yeah, we'll pass. How about in the clinics that you described? They almost sound like community centers, in a way. The type of care going on, is it again, you get back to health equity and improving people's outcomes. How much of it is preventative care versus, say, acute?
Yeah, so preventative care is becoming far more popular in developing countries, because it's not that you've solved all of the primary healthcare issues, but they are no longer the primary almost. And so, and oftentimes this has become very popular in developing countries, is doing it all at once. So you're doing the prevention while you're doing the primary and acute care. And so prevention is becoming very popular, as it should be. I mean, doing cervical cancer screenings, that's very, very popular. Doing manual breast exams for breast cancer. Years ago, that was completely unheard of. Even screening for things like skin cancer or even maternal health issues. It's, the woman is coming in for multiple screenings and multiple check-ins, as opposed to coming in when the baby's coming. People are coming in to say, this just doesn't feel right. And that's a lot of preventative screenings. There's diabetes monitoring, there's glucose checks, there's heart monitoring that's happening. And I don't know if it's because of the internet and everybody's reading about this and their children are saying, hey, you gotta come in, and and maybe that is, and that's wonderful news. I think there's just a lot more education out there. It's more democratized, so there's access to education, and it's varying levels of prevention that's happening, but it is absolutely that is a for sure booming market. But it needs to be relevant.
So to test for cervical cancer in developing countries, they use this really brilliant technique of a vinegar solution, highly efficacious, easy, very, very easy to see. And, you know, we here use a pap smear, for example, that has to be sent out to a lab and things like that. I actually find their way far easier, far cheaper, far better. And so why would you not do that? And that's a very easy primary screen. So it's becoming far more popular, thankfully.
One last just question or observation, just to ask your view on it. How about as you work with these developing countries and the people, investors, local government officials, and obviously the medical community, any challenges around training or say medical education or anything like that you've experienced?
Yeah, so so far I haven't, because there's so much access to education. And so whether it be online, whether there are people who are able to come in and do training, whether, you know, now everyone's experts at Zoom. So, you know, whether it's over Zoom or there's also a lot of teaching hospitals in almost every single developing country. There's also fellowship programs. There's almost all the doctors are you know, Europe, American trained and or at high caliber organizations and medical schools. And so they're coming back to wherever they happen to previously live and to spread that wealth around. These doctors and nurses are very highly educated and they want to be able to do their job. You know, when it comes to specific equipment, absolutely you need to be trained on certain things. The equipment manufacturers actually have been making it much easier too. And so I have to give them a lot of credit. There's also, when we talk through new innovations, a really big part of that is making it easy to use. So whether you just plug something in and it works versus a 4-day training on how it works, you know, there's online modules, you can go in, you can click through them. You know, once you buy it, they're open for you or things like that. So I'm not saying that it's not a problem, but it's becoming less of a problem and there's a lot more access to this information, thankfully.
You know, it's interesting because I know, I believe earlier today, Dr. Derek was on and for his OR technology. And if I remember from his presentation, the equipment vendor is really part of the care team.
Yeah.
You know, in a sense here, from whether it's training, setup, all of that. So it's an interesting point. It's an interesting point. Well, listen, you're such a delight. Thank you for participating today. It was a fascinating presentation. Thanks for spending time with us today. Your information's in the speaker tab, so if anybody needs to reach out to Marissa, you're available that way. And we really enjoyed your presentation, and we wish you much success here in the future. Okay.
Thank you. Thanks so much, Glenn. Thanks, everybody.
Right. Take care of yourself. Thank you.
Bye.